Yes. Okay.
Okay, start recording. Okay.
Yes. Okay. Morning, everyone. Today, I want to present about Ricket disease. Do anyone know about the Ricket? Yes or no? No. So, Ricket disease is one second. So, Ricket. It is also called as calcitonic or hypercalcemic uh, rickets. A conditions that result in the weak and weakness or softened bones in the people. Uh, yeah, the ricket disease or rickets disease is a skeletal disorder that's caused by lack of vitamin D, calcium, phosphates. These all three nutrients are most important to develop and strong and healthy bones. So the people with the rickets disease may have weak and soft bones and stunted growth and in the severity is skeletal deformities. As incidence of this disease is less than 1% per 2 lives. And so mostly it's occur in the region or area of Middle East, Africa, and Asia. Um, so mostly this rickets is can occur. This disease can occur with any different ages and different genders, but mostly it happens in children's between 6 to 6 and 36 months old. So why they are doing that? Why it's happening in the children? Because mostly they are growing and still growing, as you see here. The children are the highest risk of this rickets because they are still growing. Who is at the risk of this rickets? The children. Yes. Hello.
Yeah, we are listening.
Yes. Yeah. Who is at risk of the rickets disease? The children's or the persons who have not enough vitamin D in the life, mostly in the regions with a little light sign, or the people or the family who have the vegetarian diets, or the person or child do not drink milk productions. In some cases, this condition can be what hereditary, but in the rare conditions. So we are telling about vitamin D. So vitamin D, in these cases, vitamin D deficiencies make what's made difficult our body or body to maintain the level of calcium and phosphates. So when this ricket disease is happening, the vitamin D deficiency is there. So there are so many hormones that are affected or regulated by vitamin D. So those hormones, what causes those hormone causes calcium and phosphates to be released from your body. So when your bones like these materials or minerals, they become weak and soft. So that's meant the vitamin D help to absorb calcium and phosphate from intestine from various foods like milk, eggs, and fish. So as other hands, I have to tell the vitamins. Well, our body also make vitamins, but it's not sufficient. Uh, sufficient for in these conditions or in this condition. So the risk factors of for this disease at first is age. So uh, This condition mostly happen or is common between age of 9, as I told, 6 to 36 months old. Why? Because this period of this disease is much important. The childs are growing rapidly within this within these periods or during these periods. So the bodies needs calciums and phosphates to give the strongest strength and then develop their bones. So and other ones is diet. So about diet, so the people who have the risk of uh, what Rickets disease or who are in diet or in having food of the vegetarian diets and who have not including or having too much or enough fish, eggs, or milk. So or other people or other children who have trouble in digesting milk and or have allergy to milk sugars. So and also infants. We are talking about children. Infants who have feed breast uh, from the mother, and so uh, who the milk mother milks who it have not sufficient vitamin D for supplement. So that means shows that the mother's breast milk is too much important for the children's. So the mother diet also is important. That's helpful in the reducing of this risk. Yes. Other risk factors is skin color. So based off those studies, what happened is telling this disease is happening within those people or within those gen or this type of people who have dark skins. Means the risk of this rickets disease will be increased equal by increasing the level of darkness of the skins. So the children like Africa, what's uh, Pacific Islanders and the Middle East and like India also and Africa. So these people have high chance or high risk of this uh, exposure to this disease because their skins are producing absorbing and producing less vitamin D's. Other risk factors is geographic locations. Means and for those people can have the risk of this disease who have less exposure to sunlight or who have living indoors or working indoors during daily hours. Other risk factor is genes means it was being from uh, beginning of the birth within the genes, so which is called as hereditary rickets. Yes, the complication of this disease is bone fractures, muscle spasms, and abnormality of true spine and uh, intelli- intellectual disability. Means the thinking, focusing of the person. So symptoms. So the most symptoms of this disease, as you see here, is pain and tenderness in the bones of the arms, legs, and pelvis or spine, and stunted growth and short stature, bone fracture, small cramps, uh, teeth deformation such as delayed tooth formation, holes in enamel, abscesses, defect in tooth structures, and increase number of cavities in the nearby most of the tooth. And skeletal deformation, which is including an oddly shaped spot bow legs or the all the legs that bow out and bumps in the rib cage outcome breastbone like this area as you see here and curve span and pelvis deformations which are the most symptoms will be absorbed of the Rick's fact Rick's Rick's disease. So let's go for diagnosis of this disease. Mostly diagnosis of this disease were classified within these three types. So doctors have to classify them with these types. So types with Rickets will be classified as you see here vitamin D related risks, hypercalcemia and hypophosphatemia, and also congenital uh, rickets means it can be hereditary or vitamin D resistant rickets. So how their diagnosis? Their diagnosis as you see here, physical examination, checking for tenderness or pain in the bones by light pressing on them, and blood tests, what mostly to measure level of calcium and phosphate in the blood. Also, the next they are using X-ray to check bone deformities, and at last, if it is necessary, a bone biopsy they will use how to a very small section of bone they will remove and send to library for analysis for last results. So differential diagnosis is the osteochondrodysplasias. It's a difficult name, a long one. It is similar to to Rickets disease, or as you said, it's also known as genetic bone disease. May mimic the clinical picture of the Rickets in the regard to the future of bone deformities. So let's go for treatment. So mostly the first part of treatment is, or the aim of treatment is the focusing on replacing or replacing the missing minerals and vitamin to eliminate all of the symptoms for the person or the kid. So maybe the patient also have vitamin D deficiency. So is one of the refers exposure to sunlight or consuming foods and foods products with high level of the vitamin D, such as fish, olive oil, milk, and eggs. Also, others supplement or treatment can be the calcium and vitamin supplements can be used for this disease because all of this condition can be also referred if the patient is child, so it's referred to mother also because patient may be on the feed breastfeeds and so this supplement have to be used for both of mother and child. And at last is surgery. So surgery will happen when at the first part when surgery is required. So as we told it, one of the sign or the condition of this disease is the skeletal deformity. So the first refer is so the first refer is to keep the person in the proper situation during treatment to get back or to make the correction or to fix anyway the bones or the deformities to correction form. Or if this condition is not happened during treatment or during lifestyle, so the last refer is surgery to to make correction of the deformities. So I was checking for this disease what drug are used for exactly Rickets. So 56 medication are found in Rickets, as you see here, this table. So mostly these drugs are reviewed and used mostly for this Rickets disease, as you see here. And there's told vitamin D2 capsule, vitamin D3 calcium, and what procaltrol, and uh, replace the vitamin D tablet, vitamin D2, and calcifidiol capsule. And the one other more is it is referred as a what you call it uh, lisofrol. It is a combination, I think, vitamin D3, or which is called drop D-drop kits or delta D2. It is used mostly as the first, I think, first drug for treatment of the rickets once daily, as you see here, 15,000 mcg, and it can be used orally, which is mostly or usually divided into 4 or 6 oral doses. And also, the intramuscular injection of this medication are available. I think so. The calcitrol, which is available in our hospital, I think so. Isn't this? We saw in our hospital uh, for mostly vitamin D deficiency or vitamin D supplementary. So as you see here, those available are there capsules in 2 doses, 25 mcg and 0.25 and 50 mcg. Oral solution also is there, injections are there, and so mostly these drugs are used in the hypoparathyroidism uh, and in the hypoparathyroidism, in the moderate and severe kidney disease, as you see here, and at the important points or indication, as you see here, vitamin D dependent rickets of label. And other use is there for the maintenance serum calcium 1 to 10 mg sleepers. Yeah, in hereditary conditions, so the combination of phosphate and supplement and high level of the high level of the special form of vitamin D are required to treat this disease. But this disease is hereditary, means these drugs are not completely affected the patient. So for long time or for long period of these medications, means phosphate, calcium, or vitamin D, can affect the other hormonal productions which are going on under our body or the bodies that make other complication for the patient. So the use of these medications supposed to be properly and correctly. Yes, for preventions, it is better, what as I told previously, exposure to sunlight, and if it is not benefits, foods to eat foods containing vitamin D or take vitamin D supplements. Thank you. Any question?
Okay. Raman, do you have anything to add?
Excuse me?
Raman,
Yes, ma'am.
do you have anything to add?
No, I don't have any.
Okay. Students, okay. Okay. Students, is there any more points to discuss?
No, madam.
Okay. Ramin, what are other complications associated with rickets?
Yeah, other complication can I say it's vitamin D deficiency. So it's mostly it's affecting the hormones, on the hormones. So there are so many hormones with affected vitamin D, like noradrenaline and adrenaline and dopamine production. Also, it affecting the so it's affect what you call it.
What about Actually, other complications include congestive heart failure and seizures. Okay, this congestive heart failure
Okay.
due to hypocalcemic cardiomyopathy and seizures due to hypocalcemia. And some studies have shown that risk for pneumonia.
Okay. So you're telling about complication of disease or
Rickets.
vitamins? Rickets. Okay.
Rickets.
Okay.
Yeah,
Yes.
due to hypocalcemia.
Yes.
Okay, is there any more points to discuss? Okay, then now we can stop recording.